Welcome, everyone. Thank you so much for joining us today. This is another one of Wellspring's Be Well Talks. And so our webinar today is titled Everything is Just So Different Now, Mental Health in Adolescents and Young Adults with Cancer. And so I'm excited to introduce our speaker for today, Chana Korenblum. And so Chana is a physician specializing in mental health for adolescents and young adults with cancer. She works at Sick Kids and the Princess Margaret Cancer Center and is an assistant professor at the University of Toronto. She is passionate about working with and advocating for AYAs and their families and is excited to be joining us and presenting here today. So I will hand it over to you.
Thanks so much for having me. It's so great to be here. Let us get going here. So, hoping that folks will be open to participating. There may be some opportunities for interaction, so please feel free to use the chat box for that. And let's get started here. So to give folks a bit of an outline of what we will cover today, we'll talk a little bit about what is mental health and what it isn't. Then we'll talk more specifically about how cancer can impact mental health in young people. And then finally, what can we do about it at the end of the day? So let's start with our first question here. What is mental health? And so if folks have an idea, again, feel free to jump on the chat. Just maybe if there's a word that comes to your mind when you think about mental health, or if there's a short phrase or sentence that you feel comfortable sharing, feel free to type it in the chat, and we'll see what's on your mind when it comes to mental health. And if you're watching at home, just sort of ask yourself that question: what does mental health mean to me? We'll keep an eye on the chat here just to see if people are feeling comfortable typing in any ideas. And if not, that's totally fine too. Okay. So let's see if any of these things were on your mind when you're thinking about mental health. So mental health is generally our emotional, our psychological, our social well-being. It's how we think, how we feel, how we behave, how we act. It's really part of being human. And this may be my bias, but I definitely think that mental health is worth making time for, and that it's as important as physical health, because really they're connected. It's really hard to have one without the other. Right? So what about what mental health is not? What do we think about that idea? So mental health doesn't mean feeling good all the time, right? And furthermore, mental health is not necessarily something you can just sort of snap out of, right? If you're thinking about your mental health, if you're talking about your mental health, that's not a sign of weakness, right? And when you might think about poor mental health, that doesn't mean it's a negative thing, right? Nor, of course, is it all in your head, right? It's actually very real. Let's see where that takes us now. So we've covered a little bit about what is mental health and what it isn't. Now, let's get to the heart of the matter today, which is, how does cancer impact mental health in young people specifically? So in order to answer this question, we have to rewind a bit, right? So why are we talking about young people in the first place? Well, what we've come to learn is that cancer is very different in this particular age group, adolescents and young adults, compared to cancer in younger children or cancer in older adults. And so you may be wondering, well, how? How are adolescents and young adults, or AYA, with cancer different? Well, in a few ways. So biologically, there are certain cancer types that are more common in this age group. So certain types of lymphomas, certain types of thyroid cancer, testicular cancer, and certain brain tumors, among other cancer types, right? And some of those types might be more aggressive in this age group as compared to younger children and older adults. Now, what about the way certain cancer treatments work differently in a body that's still growing and changing, right? So that's another difference. And then if we think about relationships, about body image, about school and work, that's going to be very different in a young person than an older adult, let's say. And even when we think about the brain, so when we think cognitively, young people definitely have an understanding of how severe or serious their condition is, right? And that's different than younger kids who might not fully grasp what's going on when they're given a diagnosis of cancer. But compared to older adults, young people might not have that frame of reference for how to cope with something so serious. So above all, it's a different life stage. And that's going to help explain why mental health is different in this life stage. So when we think about this sort of struggle or tension between the demands of the life stage and the demands of cancer, we have cancer on the left here, where young people feel particularly isolated, feel very vulnerable, they feel dependent on others, and there's a lot of uncertainty, right? Whereas someone who's an adolescent, a teenager, or a young adult, they're going to feel very connected to their friends, to their family. They're going to feel, almost invincible, right? And they're going to really value being independent and doing things on their own. And they want to feel in control, right? And so cancer can sometimes be directly at odds with the demands of being a teenager or a young adult. And so what we see is cancer ends up disrupting all of the domains of this life stage. So if we think about the emotions that get disrupted, we think about practical things like finances, school, work. We think about the impact on relationships, family, friends, romantic relationships. We think about fertility. We think about body image. So all of the big domains of development for somebody who's in this age group, they're going to be disrupted in a big way by something like cancer. And then we have this problem. Cancer care was not made for young people. So this is a bus shelter ad from a charity in the United Kingdom that really supports a different kind of care for teenagers and young adults. And so what they've done with this message is they've said cancer care made for young people, right? Because when you think about it, when you break it down, you have the average age of a child with cancer is 4. And the average age of an adult with cancer is 60. And so when we talk about this in-between age group, adolescents and young adults, which, is defined in different ways in different places, but, for the purposes of today, we'll look at this range from 15 to 39. They're stuck in the middle, right? In between two systems, neither of which is really designed to meet their specific unique needs. And so what we find is we have this intersection of being a young person in an already very busy and complicated life stage. And then we add this layer, we add this diagnosis of cancer. And when we think about those intersections, how can it not impact mental health, right? So now we go back to that question, how does cancer impact mental health in young people, right? Now, it's going to be common to struggle with your mental health at any age when you have cancer, right? And cancer affects different people in different ways. But there are some common feelings. So again, if you're feeling comfortable to share in the chat, think about a feeling that maybe you felt because of cancer, or maybe, a friend or a family member has told you they've felt because of cancer. Just feel free to type one word, an emotion, a feeling, if you're comfortable sharing about some of the feelings that come up when you hear that word cancer. Give folks a minute if they're feeling like they want to share in the chat. Okay, we've got overwhelmed. For sure. That is a big one. Okay, hopelessness and worry, isolating. Yeah. So all kinds of feelings, right? Scared is a huge one. Right. Okay. So keep them coming. If you'd still like to share a feeling in the chat. And we'll just look at this image here. Some of these have come up in the chat already, right? Feeling isolated, feeling scared, feeling hopeless, feeling worried, or feeling anxious, right? Now, you might not be able to control all the feelings that come, but it can help to start to think about what they are, to start to name them. And then it allows you to think about how they might affect you, right? Or how they might affect someone close to you that's going through this. So what about when? When do the feelings come in terms of the timeline of the cancer experience? Okay. Well, they can really come at any time. They can come even before diagnosis, while you might be worried that, there's a problem and you might be waiting for results of tests to come back, right? They can happen around the time of diagnosis. They can happen before treatment starts, during treatment, and really all the way through. And they can come for you, they can come for your friends, your family members. And so what happens if the feelings don't go away? And so we'll just spend a brief moment here talking about the differences between something like sadness and something like depression. So sadness is obviously a normal human feeling, it passes with time. It doesn't tend to interfere with daily life. Life tends to be able to go on. And people can still find joy in some of the interests and activities that they like to do for fun. And it often goes away on its own, right? In contrast to something like depression, which is a kind of mental illness, where those feelings can last for much longer, right? Weeks, months, or even longer than that. Usually those feelings are interfering with daily life, making it hard to do the things that people do every day, and hard to find joy in those things that people used to like doing, and usually requires some type of professional help. And so similarly, if we were looking at a feeling like worry or feeling anxious, again, a normal human feeling that goes away, there's often some type of trigger, not always. The worries tend to be few in number. Life tends to go on, and the feelings tend to resolve, right? Versus, again, something like an anxiety disorder, which, similar to depression, can last a long time. Sometimes there isn't a trigger, it just comes. It's very hard to control. The worries can be varied, there can be many of them. It's disruptive, it kind of gets in the way, and that's when professional help can be really important. So what kinds of mental health conditions might we see in some adolescents and young adults facing cancer? So this probably won't come as a surprise, but a number of young people will report depression and anxiety. So PTS, post-traumatic stress symptoms. So sort of nightmares or flashbacks, or kind of feeling always on edge. Up to 90% of young people will report those symptoms. A much lower proportion will actually have a diagnosis of post-traumatic stress disorder. Many people are afraid of the cancer coming back. That's one of the most common mental health conditions is being afraid of cancer coming back, and substance use disorders as well. So we've talked a little bit about mental health. We've explored how cancer can impact mental health in young people. Now let's talk about what we can do about it. And so here comes the idea of a coping toolbox. And I'd love to spend a few minutes here, because I suspect that folks tuning in have a coping toolbox, right? We all have this invisible box we carry around with us, right? A situation we encounter comes up, we open up the box, we pull out a tool, it works, great. It doesn't work, we toss it out, we open the box again. What else is in there, right? So we all have these boxes. I would love to hear again, if people are comfortable sharing, what is already in your toolbox? So feel free to jump in the chat. It could be a person, it could be an activity. Um, so just maybe something that, what is your go-to that you think other people actually might benefit from knowing about, because then maybe they can add it to their own toolbox. Maybe it's a particular show that you're watching. Maybe it's a particular, maybe it's a kind of food that you like to eat, right? So think about what's in your toolbox already, and what has tended to work for you. Because if it's worked for you, chances are it may be helpful to somebody else. So what we have coming through now is talking to someone who's gone through the same experience. So that can be huge, right? Someone else who gets it, right? Very different than, someone on your healthcare team, right? Maybe they've seen a lot of people going through it, but they haven't necessarily, or maybe they have, but they haven't necessarily gone through it themselves, right? So talking to someone who's gone through the same experience. Okay, here we've got a number of tools. So my son, so that it could be someone in your family. Walking, so moving your body, being active, getting outside, getting fresh air. Walking is a very common and excellent coping tool that's in a lot of people's toolboxes. Cooking, making a meal, being focused on following a recipe or not, maybe sharing that meal. Okay, work. Yes, work can be a very powerful distraction, right? There's a routine that comes with work, and there's a shift towards a different kind of identity, away from, I'm a person with cancer, to I'm a person who works, who has this particular job, that's important to me, right? Computer games is an excellent one, right? Maybe that's a game you play on your own or with other people. Okay, the box is really filling up here. We've got another excellent one coming through. We have having my partner block Reddit for me so I don't go on cancer forums and spiral out of control. I was just talking with a young person yesterday about this, and how they're getting a little bit sucked into that Reddit world, right? And so having somebody sort of help you set boundaries around that, right? Okay, somebody who saw a therapist for a few months, that was really helpful. So yeah, I mean, a professional, mental health practitioner can be a hugely important coping tool. Attending support groups with Wellsprings and Gilda. So again, tapping into that idea of finding other people who have gone through something similar, so you're not feeling as isolated or as alone. Hiking and camping trips really help disconnect and feel revitalized. Absolutely, absolutely. If you're able to get out into nature, yeah, to have a break from technology, that can be hugely helpful. Talking with friends, so that social connection, again, that helps with those feelings of isolation. Different physical activities, running, biking, walking, for sure. So many potential benefits, right? You get better sleep. Sometimes there's a social element if you're being physically active with somebody else. Just the way your body might feel after, the way your brain might feel after, certainly positive mental health effects of physical activity, for sure. Volunteering at my local animal shelter with the dogs. Oh my goodness. Pet therapy is a whole kind of therapy on its own. But here is somebody who's donating their time, and so they get the impact of being with the animals, and maybe tapping into sort of like this deeper meaning or purpose behind giving your time. Fun music, of course. Music is a big coping tool that's in many people's toolboxes. Some people have a playlist they listen to while they're getting treatment. Some people will listen to music while they're in the waiting room. Some people, if they have to stay overnight in the hospital, they're making sure they have, their connections to their music with them. And then, of course, music at home and out. Okay, the box, it continues to grow here. We have somebody sharing that keeping life outside of the hospital visits as normal as possible. Yeah, so I think we often underestimate the value of a routine, right? To sort of keep things balanced, keep things feeling grounded, because it's easy to kind of get caught up in the hospital world, right? And so when you're not there, trying to keep things as normal as possible. Okay, we've got another one coming in here doing word search puzzles to distract myself and keep my brain occupied. Right? What a great one, right? A great one. And you can get a word search puzzle from the drugstore. You can get one online and print it out. You can do one online, right? There's so many ways to do puzzles online. So that's a distraction tool, and it's kind of keeping the brain occupied, right? Excellent. So the box is feeling really full. And maybe you've picked up a new tool from somebody today, just in the chat, something new that you might want to try that you haven't tried before, or maybe you've seen someone else who has the same tool as you, and you now have that kind of in common with them. So just kind of keeping that toolbox close, and when it feels like none of the tools are working as well as they used to, that's a chance to think about adding a new tool and what that new tool might be. Okay. So I was actually speaking with some of my young patients, and I was asking them, what tips they might have for other young people and their friends and their families facing something like cancer, about what they can do for their mental health. And these are some tips that a particular young person shared with me that I wanted to share with all of you. So she says, there's no logic to it. Why some people get sick and others don't. You're going to break and you need something to pull you back up. What's going to get you through a tough day? What inspires you? You need some kind of foundation. Where do you go in your mind when you're having a scan? Where are you going to refuel your energy? Establish a system that will pull you up. The waves in the ocean come back and forth like our emotions, up and down. You need faith. Have something fun planned after something stressful. Break up the journey. Take things one day at a time. Don't assume the worst. When it's hard to see forward, remember there's life beyond cancer. You will heal and grow. So I love these words because, first of all, I think they build on so many of the tools that you put into the chat that you're using already. Having a foundation, establish a system. And then maybe there are words here that are helpful for you. Maybe you've heard them before, and so they're not new, or maybe you're hearing some of these words for the first time, and just know that they're coming from someone who's been there. Okay. So I'm going to do a quick time check. I think I do have time to go through these last few slides. And what we'll do now is we'll talk about 3 steps to coping with cancer. So again, some of these tools are already in your box, which is great, and some of them may be new, but we'll go one by one. And these steps have come out of professional work with people with all kinds of different serious illnesses, but they can really be applied to anything difficult that somebody's going through. And the idea is once you try the first step and it doesn't work, you move on. And we'll go through each step one at a time. So first we have problem focused. This is the type of coping that most of us use most often. So the idea here is to break big problems down, to make sure you have the information that you need, and to focus on communication. So what are some examples of problem-focused coping? Well, you could make a list of questions to take with you before your next appointment, so that when you go in and see your doctor, you can look at your list and say, I have 3 things that I'd like to talk about today. You could take somebody else with you, or you could have them call in by phone to that appointment, because it can feel overwhelming to be alone when you're receiving difficult information, or even when you're having a regular check-in with your doctor or a healthcare provider. You could ask a friend to help with things like cooking or things like driving. So problem-focused coping, things that are within your control. So next we have emotion-focused coping. So what that means is feeling better about things you can't control. So some examples here are accepting support from others. So very difficult if you're used to being independent and functioning on your own. This may be time to switch gears around that. And that doesn't mean you're weak or you're a failure or you're not able to manage. It's just, cancer's just too big sometimes to do it alone, right? To try to avoid things like self-blame, right? You didn't choose to be in this situation, right? To try to set some boundaries. So the Reddit example was a great one, right? If you find that you are over-focused on something that's actually making you feel worse, maybe get some help in preventing you from going there. Right? And then, as so many of you mentioned in the chat, things that involve self-care, right? So moving your body, being physically active doesn't mean doing a high intensity workout at the gym, right? Getting out for a walk, getting out for a bike, a run, something like that, right? Even getting up out of bed and getting out of your room, that counts as moving your body, right? And of course, sleep and eat and all those things. Right? Okay, so what if there's no real way to solve the problem and there's no real way to feel better about it? That's when we have to try something different. So that's when we get to meaning-focused coping. And this is the idea that we start to tap into some of our personal values, things that give us meaning and purpose. And we did hear that again in the chat, either around volunteering. Sometimes it comes from work, sometimes it comes from family. So the idea is not to be okay with the situation, but to accept that it's not helping anymore to try to solve the problem. Right? And so that allows you to reflect on things that are most important to you, even in the hardest times, right? And some people find their faith to be very helpful with this kind of coping. So those are 3 steps. Again, just to go back real quick. So the problem-focused coping that most of us do most of the time, emotion-focused or trying to feel better about the problem if you can't solve it, and finally, meaning-focused coping when we can't solve or feel better about it. Okay. So here's a question, again in the chat. Can positive feelings come after cancer? So you could answer yes, you could answer no, you could answer not sure. But what do you think about this question? Because we've talked a lot about some of the difficult feelings or some of the harder or more negative feelings. What about this idea of positive feelings? Can positive feelings come after cancer? Someone here in the chat says, yes, I feel once chemo was done, all my love for life came back. I'm glad to hear that. Okay. Okay, so sometimes there is that potential for positive feelings to come after cancer. So we heard a little bit earlier about post-traumatic stress. Now there's this sort of opposite feeling, this opposite phenomenon, post-traumatic growth. So some people do report this sort of new perspective on life. I'm focusing now more on what matters most to me, right? Many people wrote in the chat about either a support group or talking to someone else that gets it. Getting support from other people in a similar situation, that can feel helpful, that can feel good. People talk about appreciating the small things, about giving back, about learning about how strong they are. Strength is a tricky one because some people feel like they don't have a choice. Oh, oh, you're so strong, you're doing chemo, I could never do that. Well, I didn't really have a choice, I had to do it. And so that strength word is a little bit tricky, but sometimes people do feel surprised about what they've been able to go through, what they've been able to manage. Somebody else here in the chat has said positive feelings can come. It can be difficult at times, but I think that if we have good people in our lives, if we create magical moments, whatever that may look like, we definitely can. Oh, that's so beautiful. Thank you for sharing that. I want to read it one more time. It can be difficult at times, but I think that if we have good people in our lives, if we create magical moments, whatever that may look like, we definitely can. I just love that. Okay, so coming very close to the end here, I just wanted to put up this image because it's really powerful. Liz is she's an illustrator, she's a cartoonist. She says, when you're feeling low, it can give you strength to think of what you've gotten through before. That doesn't mean you need to celebrate or be grateful for a horrible experience. It just means you can give yourself credit for still moving forward and holding out hope that there are better days ahead. And then we're going to hit our last points here. So just to reiterate, it's normal and expected for cancer to impact your mental health. How can it not? It's just too big. There's no one way to feel about having cancer. There's no right or wrong way. And some feelings are shared between many people or almost everybody, and other feelings are very unique and very personal. Your coping toolboxes are already so full. And thank you again for sharing everything that you're doing to help cope. And maybe again, you've picked up one or two new tools to keep it full, right? And finally, getting help is not a sign of weakness. In fact, everybody should be offered some kind of help, right? When dealing with something so big. So ask your team, whichever member of the team you feel most comfortable talking with. Ask your family doctor if that's the person that's more available or accessible or supportive or whatever. Ask your family, ask your friends. They are desperate for ways to help you. So I think I will just share some of these resources, which many of you have come across. Obviously, Wellspring is right up there. Young Adult Cancer Canada is a national charity that supports young adults. If you Google them, you will find their website and their fantastic programs. AYA Can is a patient-led, patient-driven advocacy group that's doing some amazing things across the country to help raise awareness and make change and improve care for adolescents and young adults with cancer. We have Pink Pearl Canada, another national charity resource that supports young people who identify as women going through cancer. And we have the Princess Margaret Adolescent and Young Adult Program of Ontario. That's just one hospital that's got some excellent supports and resources out there for adolescents and young adults. So feel free to check any or all of these out. I know I've left off many other ones, and my apologies. I wanted to share ones that anybody in Ontario could access. But please do pop it in the chat if I've forgotten one that you think might be helpful to other people, or one that's been helpful to you. And I think there I will pause, and I'm happy to take any questions or hear any comments.